Alright, so tibiofemoral joint mobilization. You apply a little distraction on the tibia, and for grade 1, it's right there at the beginning of joint play, so you distract and then move it just a little bit, and that's your grade 1. And your grade 2 is at the middle, so you go right past that beginning of the joint play and you kind of oscillate in the middle. So grade 3 is middle to end, so you find the end and then go right before that and oscillate. And grade 4 is at the end, so you find the end and oscillate right at the end. And the amount of pressure is quite significant for the knee mobilization because there's a lot of structures in there and it takes a lot to move it. And for the hand, the second metacarpophalangeal joint, you distract, and right at the beginning of joint play is right where you start oscillating posteriorly. And the amount of pressure that it takes to do this mobilization is a lot less than the knee because there's not a lot of structures here and it's a small joint. So grade 1 is again right at that joint, right at the beginning of joint play. And all the way to, well, grade 2 is right past there again, right at the middle. And then grade 3 is at the, you find the end and then oscillate right before the end. And grade 4 is the end for tissue mobility. And you find the end and oscillate there. So for the glenohumeral joint, with grade 1 and grade 2 being mainly for pain, I stabilize right at the glenohumeral head and stabilize at the clavicle and kind of distract inferiorly and start to oscillate anterior and posteriorly. So grade 1 is again for pain modulation, and it's right when you start moving anteriorly. That's when it is grade 1, and grade 2 is right past there in the middle of the joint play. Grade 3 is you kind of find the end, oscillate right towards the end, and grade 4 is right at the end and you oscillate towards the end anteriorly. So the range of the joint mobility in the glenohumeral joint is relatively the same throughout. Doesn't really change much.